Good afternoon, Mr. Jones. My name is Cassie Meyer, and I'm a nursing student at the University of South Alabama, and today I have orders to change your wound dressing. So before I get started, I'm gonna look over the policies and procedures, and I know them all, and I'm okay with them, and I'm gonna make sure I have all my materials, and I do. And now, Mr. Jones, I'm gonna perform hand hygiene. Okay, Mr. Jones, I want to double check that what I have written down as your name and date of birth is correct, or is what is on your tag. So, Mr. Jones, I see your name is Jaguar J. Jones, and Jaguar J. Jones is on my chart, and your date of birth is 8/25/1963, and 8/25/1963 is also on my chart. I also see here that you are allergic to penicillin. Are you allergic to anything else? No? That's great. So I've already closed the drapes to the room, so no one is going to be looking in here. You're going to have complete privacy when I change your wound dressing. Okay, now I'm going to wash my hands. When I wash my hands, I'm going to be using lukewarm water and 3 to 5 milliliters of soap, washing thoroughly on all sides of my hands for 15 to 20 seconds. And so first I'm going to check for any cuts or abrasions on my hands and look at my nail beds to make sure everything is okay, and it is. And I'm going to get every nail. I'm going to dry from the tips of my fingers to my wrists. And same here, tips of my fingers to my wrists. Now I'm going to use this to turn off the faucet. Let me drop that. So, one thing about soap is that you have to use soap and water when you're moving from patient to patient if you have any bodily fluids on your hands or anywhere else. And another thing that you would use it for is to prevent the spread of microorganisms such as Clostridium difficile. And if you are using your antimicrobial hand rub, then you would use that when you take off your sterile gloves or when you touch any inanimate objects within direct vicinity of the patient, such as what I'm about to do here with the trash can to move it over. So now I'm going to perform hand hygiene again with my hand scrub. Okay. All right, Mr. Jones, I am going to raise your bed all the way up and take the guardrails down, and that way I can get you better. And now I'm going to put on my protective equipment. Okay, now, Mr. Jones, I'm going to take off your first wound outer ABD pad. All right, and Mr. Jones, okay, the type of secretions that we have on here are just regular Purulent, and the amount is just a slight amount, and the concentration is very thin, and the color is yellowy, white, clear, and the odor is none, so we're all good. And now I'm going to take out your inner dressings. Okay, and now I'm going to look at the wound itself, and the wound has slight granulation and a little bit of swelling. And now I'm going to palpate the period wound area. Tell me if you feel any tenderness. Okay, I don't feel anything either, and I see that there's a little redness and swelling around the edges of the wound. It's about a 3-inch size wound. But other than that, you look good, and now we're gonna change the dressing. So I'm going to keep my hands toward the trash can and keep glove to glove and skin to skin. And now I'm going to oh goodness. Okay. Now I'm going to set up my sterile field with my dressing change tray. Only touching the outside 1 inch of the box. I'm going to take that out and tape up my sterile field, and only touching the 1 inch border. So my sterile field is laying off my table, so my 1 inch border consists of everything that is on the table and a 1 inch border around it. When I was setting it on the table, only the edges of it touched the saline solution, so I did not break sterility. And now I'm going to dump this onto my field. Okay, it's still within the 1 inch border. And now I'm going to pick up my saline solution, and I see that it's not expired yet, so I'm going to palm the label and open the cap upwards and slowly pour the saline into my change tray. Okay, and cap it. Did not splash anywhere. All right, now I'm going to don my sterile gloves. Okay, so I'm left-handed, so I'm going to put on my left-handed glove first. Okay, I am going to slip 3 fingers into the right glove, and keeping my thumb away. Skin to skin and glove to glove. Okay, now with everything in my sterile field, I'm going to take 4 of these gauzes and soak them, and I'm going to put this in the wound itself. And I'm also going to clean the stitches. So first I'm going to wring this out, and I'm going to drape this over my fingers and clean from cleanest to dirtiest. without touching anything else. So I'm going to go straight down the stitch line. Now this is dirty. So I'm going to throw that away. And another one on the other side of the stitch area. Wring that out, not touching the sides of my tray. And I'm going to wipe down the left side and throw that away. And now I'm going to wipe down the right side. Careful, only to touch. Oh, I need to wring it out a little bit more. Okay. There we go. Perfect. And the right side. All right, now I'm going to pat down the wound, pat the wound dry. I'm just going to go down the center of the wound. Great, so I've cleaned the incision line and it is still intact. And now I'm going to insert more gauze into the wound area. I forgot to add the gauze earlier to the solution, so I'll add that now. And I'm going to rinse this out a little bit and fluff it. Wring it out. Then we're going to fluff it again. All right, there we go. So that's not too packed, but it has enough in there. Then I'm going to use my AB D-pad and lay it over the top. Now that everything is all clean, and now I'm going to take off my sterile gloves. Using skin to skin and slipping a finger under my gloves. Okay, now I'm going to put the tape on. Mr. Jones, you did very well. Your pain tolerance seemed very well, and normally if I was in an actual clinical scenario, I would use this piece of tape and write my initials, time, and date on it and stick it so that the next person who changes out his wound would know I was the last person to do it and when. And I'm going to clean up my sterile field and Mr. Jones, I'm going to lower your bed back down, as I would with all patients, and raise the side rails up. Are you still in a comfortable position? Yes? Okay, Mr. Jones, you did really well. Have a great day.